To open a drug rehab in California, you must be licensed by the state. And California lost over 5,500 people to opioid overdoses in 2023. California recorded over 5,500 opioid-related overdose deaths in 2023. According to the California Association of Alcohol and Drug Program Executives, how to open a drug rehab in California in 2025. The licensing, staffing, and compliance steps for operators planning a new facility. We cover DHCS licensing, location and zoning, staffing requirements, and the compliance checklist every new California facility has to clear. A California drug rehab provides structured treatment for substance use disorders, and demand keeps climbing as more Californians seek help. Centers offer levels of care from detoxification and inpatient treatment to outpatient services and counseling. Around 8% of Californians age 12 or older reported illicit drug use in the past month, fueling steady demand for treatment. The Post is blunt about why new facilities fail. They underestimate costs, miss DHCS requirements, or pick the wrong location. Industry estimates put inpatient rehab near $50,000 per patient annually in California. Per Top 30 California Drug and Alcohol Rehab Centers 2024. Capital you must plan for. Failing to meet DHCS certification requirements leads to costly delays, and many new facilities fail simply from insufficient capital. The Post's first expert tip is to leverage technology, using Behave Health's all-in-one platform for clinical documentation and billing. Behave Health's all-in-one platform is designed to support clinical documentation and billing in one place, so a new center isn't stitching tools together on day one. The guide urges focusing on compliance early to avoid costly mistakes. Software designed to support that work helps you get it right before you open. The guide breaks the build into 4 core requirements every new California facility has to get right. Business plan, DHCS licensing, location, and staffing. Let us walk through all 4. Requirement 1. Develop the business plan. Research local demand for addiction services and project startup costs like property and licensing fees against ongoing operating expenses. Decide early whether your facility will offer inpatient services, outpatient care, or both. It shapes everything that follows. Requirement 2. Secure your license from the California Department of Healthcare Services. Every rehab center must be licensed by the California Department of Healthcare Services through its Division of Behavioral Health. The application requires documents including proof of insurance, employee handbooks, program descriptions, and health inspections. Requirement 3. Select a compliant location. Ensure the site complies with local zoning laws before you commit. Zoning is a common, avoidable stumbling block. Choose a location that is accessible but away from high-crime areas to create an environment conducive to recovery. Requirement 4. Meet the staffing requirements. Hire qualified medical professionals such as licensed counselors, nurses, and doctors, and make sure all staff meet state licensing requirements. Many states require your executive director to have significant management experience in healthcare or behavioral health, though specifics vary by state and program type. Before opening, the guide lays out a compliance checklist that keeps you on the right side of federal and state rules. Obtain DHCS certification and develop HIPAA-compliant data systems to protect patient information. Ensure all staff are licensed according to state requirements and secure liability insurance coverage. Create policies that align with federal laws like the Affordable Care Act before you take your first admission. The guide flags trends to plan around as you design programs and budget for the year ahead. Virtual therapy is becoming more common, and facilities increasingly integrate mental health services into addiction treatment programs. Keep an eye on potential updates to Medicaid funding and new state regulations affecting SUD treatment centers. Behave Health's all-in-one platform is built to carry the administrative load of a new California center as you stand it up. The platform is designed to support clinical documentation, so program descriptions and records stay organized from your first admission. Billing is built into the same system, designed to support compliance with insurance billing standards as you scale. Leveraging the platform early supports the guide's advice to focus on compliance before you open, not after. Stop guessing how to license and run your California center. Book a 20-minute demo at behavehealth.com. See the all-in-one documentation and billing platform built for California behavioral health startups at behavehealth.com.